There's been a disturbing change in how patients with hiatal hernia are being treated, and I've been seeing this just in the past year actually. My book, Hiatal Hernia Syndrome, came out at the end of last year, and in the book when I talk about surgery for hiatal hernia, I speak about the fact that the results are poor, they're not long lasting, and so unless literally most of your stomach is above your diaphragm and you can't eat, then it's a good surgical intervention because you're literally not being able to consume nutrients. But for someone with a small or medium hiatal hernia, to talk about surgery when the intervention has poor success doesn't make sense, and we really didn't used to hear about that. It used to be a gastroenterologist either wouldn't even mention that someone had a hiatal hernia, or if they did, it was sort of brushed off as, well, it's small, it's medium, no big deal, it's not causing your symptoms. And I know many of you are nodding who've been through this, as far as, you know, if you're having heart palpitations or shortness of breath or panic attacks, you're told this has absolutely nothing to do with your hiatal hernia, which is completely untrue. But this change that we've been seeing as a team in the last year is all of a sudden more patients are being sent to surgeons for consultations for their hiatal hernia. And in the main, these patients have small hiatal hernias. It makes absolutely no sense. I mean, surgery is always a dangerous proposition. Going under anesthesia is always a dangerous proposition. It's certainly not anything to take lightly. But the reason I wanted to mention it today is because 2 days ago I spoke to a mother with a 10-year-old. This young man is 10 and he has a small hiatal hernia, and they were actually sent to a surgeon who was recommending surgery on a 10-year-old. So this is really a dangerous precedent. All I can think is that with the increased discussion of hiatal hernia, more people are wondering if they have it, they're being educated, which is the whole point of this channel, which, by the way, if you like this content, please give us a thumbs up, subscribe, tell friends about it, because that's the whole point, you know, is to increase the knowledge of what this is, because so many are suffering and they have no idea why. They're told it's all in their head. But again, getting back to this young man being recommended surgery with its poor outcome, it just doesn't make any sense. And the only thing my team and I can come up with is there's more discussion, and we're helping to contribute to that, but there's more awareness. So patients are going to their gastroenterologist saying, do I have a hiatal hernia? And because they don't have any tools other than antacids, they're resorting more to surgery, which is scary. So I just want to share this with you, that do your due diligence on the outcomes of surgeries. Remember, the surgery as success just means that the procedure that the surgeon tried to do, he or she successfully did. That doesn't mean success in the way a patient would want success, meaning this is never going to bother me again. And why is it that there's such poor outcome for hiatal hernia surgeries? Let's look at that. Because remember, we're talking small, so the opening has just expanded a little bit because the stomach is pushing up, and the surgeon goes in there and sews that closed. By the way, one thing which might not sound like a bad thing, but when you have hiatal hernia surgery, you can never vomit again. Now, certainly not something fun to do, but if you ever really need to, and the body, you know, had food poisoning or something that it just says, I want this out of here, I don't want this to go through my digestive tract, it is a nice thing to be able to do occasionally. This one young man, this 10-year-old I'm talking about, for various reasons, he, as a kid, vomited a lot, and it's something his body kind of regularly does as soon as he doesn't feel comfortable. So imagine doing that to him and sewing this so tight that he literally could never vomit again as long as he lived. You know, it can be a little scary if you really feel the need. It can be quite miserable, and we've spoken to patients who have gone through that. But more importantly is the fact that you've closed that widened opening. They've stitched that closed, or tighter where it should be. So just the esophagus is passing through, and now the stomach is nicely below the diaphragm. But remember, what's the root cause? What caused that stomach to spasm and push up? sewing is getting in there and sewing that widened opening more narrow is not getting to the reason why the stomach is in spasm. And guess what? The surgeries fail over time because that stomach spasms again because you didn't get to the root cause of why, and it pushes up again, and guess what? It widens the opening, I should say, again. And so then you have a failed surgery, right? So do not underestimate the importance of getting to the root cause of why. And let's look at the flip side. You get to the root cause of why, that poor little spasm stomach that's pushing up is no longer. It relaxes. We do some things as part of our program. We relax the diaphragm and relax the stomach and get to the cause of digestively, nutritionally, etc., why the stomach was in spasm. Now it's not. And guess what? The body loves to heal. So that widened opening, it starts doing exactly what it should, is finding its home, going back to where it should be because all that stress and irritation is relieved. So hopefully you found this interesting. If you know somebody who's considering surgery, they really need to know the high percentage of failure rate. They really need to know about the whole vomiting thing, which I know, again, who wants to vomit? But we've had several patients come to us post-surgery and talk about how miserable they are and how none of their symptoms changed since the surgery. And of course, no wonder, because the surgeon didn't get to the root cause of why they have hiatal hernia. If you are suffering potentially from a hiatal hernia, or you know someone is, please reach out. We're more than happy to offer a free consultation to them, to you. Just contact our website, which is rootcausemedicalclinics, that's plural.com. And we do telemedicine all over the country. We have a clinic in California and a clinic in Florida, but we're more than happy to offer a free consultation either in person or over Zoom.